They can look like a highlighter, a USB drive, or something small enough to disappear in a student's pocket. And health advocates are warning families about products that can be easy to hide, highly addictive, and increasingly familiar to young people: e-cigarettes and nicotine pouches. According to the FDA's latest National Youth Tobacco Survey, about 2 million middle and high school students reported current use of tobacco products in 2025. 1.44 million reported using e-cigarettes, while about 460,000 used nicotine pouches, and flavors remain a big part of their appeal. Nearly 9 in 10 youth who vape use flavored products, and the number is even higher among young nicotine pouch users.
So when we look at the numbers, we've seen declines in cigarette smoking, which is a great monumental public health achievement, but there's still 1 in 10 kids across this country who are using some form of tobacco products. About half of those are using e-cigarettes, which are the most commonly used tobacco product, and the second most common is nicotine pouches.
Nicotine can be especially harmful to young people because their brains are still developing. The CDC says nicotine can affect areas involved in attention, learning, mood, and impulse control, and can lead to addiction. Health officials also say some young users are consuming nicotine frequently. More than 1 in 4 youth who currently vape reported daily use in the latest federal survey. Experts say spotting the product is only one part of the equation. How parents talk to their kids about nicotine may matter just as much.
We know that short, repeated conversations are better as opposed to a long lecture. And it's also important to focus on the facts, including these risks of these products, in a non-confrontational way.
And if a child is already vaping or using nicotine pouches, experts recommend treating it as a health issue and getting professional support.
If kids are using these products, that they're connecting them to healthcare providers such as a pediatrician to help them quit.
The warnings come as the FDA changes how it handles some nicotine products. Earlier this year, the agency authorized e-cigarette pods in flavors including mango and blueberry, saying its review found potential benefits for adults who smoke and included safeguards intended to restrict youth access. A separate FDA enforcement policy also allows certain unauthorized e-cigarettes and nicotine pouches to remain on the market while applications are under review. A move tobacco control advocates worry could increase young people's exposure to flavored products.
CDC's main program for addressing tobacco product use, including among kids, has been fully eliminated. And so that's all the more reason for all hands on deck, including parents and educators, to be mindful of the risks of these products to kids. We're also in an environment where FDA is authorizing more tobacco products for sale and making it easier for existing products to stay on the market and not risk enforcement action.
Youth tobacco use has fallen significantly in recent years, but advocates say it's still important for parents to know what these products look like, understand the risks, and keep the conversation going year-round.